Welcome to Lesson 20, the respiratory system. In this lesson, we'll cover the anatomy and function of the respiratory system, common disorders, effects of aging, and the role of the QMA, as well as oxygen administration and medication categories. By the end of this lesson, you'll understand the structure and function of the respiratory system, common disorders, how aging affects the lungs, how oxygen is safely administered, the QMA's role in care, and classification of respiratory medications. The respiratory system includes the nose, mouth, pharynx, larynx, trachea, bronchi, bronchioles, alveoli, and lungs. These parts work together to bring oxygen in and remove carbon dioxide. The respiratory system allows oxygen to enter the bloodstream via the alveoli and removes carbon dioxide. The medulla and pons in the brainstem regulate breathing rate and depth. Adult rate is 12 to 20 breaths per minute. Disorders include upper respiratory infections, asthma, bronchitis, emphysema, pneumonia, COPD, lung cancer, tuberculosis, rhinitis, and allergic reactions. Each affects lung functions in unique ways and may require long-term treatment. Allergic reactions can occur when the body releases histamine in response to allergens. This causes symptoms like sneezing, rash, or difficulty breathing. Anaphylaxis is a severe, life-threatening reaction requiring emergency medical care. As people age, their lungs lose elasticity, alveoli become fewer and less effective, and respiratory muscles weaken. The cough reflex diminishes, increasing the risk of infection like pneumonia. Oxygen is a prescribed treatment for those with low oxygen levels. It can be delivered through different devices. Proper monitoring and care are needed to prevent complications such as dryness and skin breakdown. They might have like a humidifier with the oxygen. It's just like a little, they call it a bubbler, and it's like a thing of water that attaches to the oxygen source. As QMAs, your only role in administering oxygen is in an emergency situation. And that's in this slide. QMAs may administer oxygen in emergencies and must be alert for signs of discomfort or equipment issues. They must be clean around the device and be ready to respond in case of fire or other emergencies. Medications include cough suppressants, mucus thinning agents, bronchodilators, antihistamines, decongestants, and antibiotics for tuberculosis. Monitor patients for side effects like drowsiness or rebound symptoms. That's really common when you take too much of the medications. Also read your textbook because they list out every medication that you guys might see. QMA should encourage residents to stay hydrated, pace their activities, and follow infection control. Promptly report any respiratory symptoms like shortness of breath or cough to the nurse. The respiratory system is critical for oxygen delivery and waste removal. Disease and aging affect function. QMAs help monitor, support, and ensure safe care through oxygen use and medication assistance.